Hi, I'm Audra Burns from Dartmouth-Hitchcock, and welcome to our virtual roundtable series, Heads Up, Coping Through COVID-19. Today, we will be discussing working through the challenges as a frontline worker during the COVID-19 pandemic. Joining me today is Amanda Smith, a registered nurse in the intensive care unit at Dartmouth-Hitchcock Medical Center. Hi, Amanda.
Hi.
Caitlin Woodbury, store manager of Co-op Community Market in Hanover. Hi, Caitlin.
Audra.
And Zac Conaway, Director of Environmental Services at Dartmouth-Hitchcock Medical Center. Hi, Zac.
Hello.
It's so great to have all of you here today. So let's jump right in with Amanda. As an ICU nurse, you experienced the COVID-19 pandemic firsthand. Can you tell us what challenges you faced in the first few weeks during the pandemic?
Yeah, so our personal protective equipment and the way that we don and doff changed quite a bit. We had all hands on deck, and we actually had to come up with a policy to safely don and doff to make sure that we were providing safe care for our patients, but also not causing any exposure to our coworkers or our community. We designated a new donner doffer role just to make sure that people were safe and following the protocol. And at Dartmouth, we were extremely fortunate to have a lot of reusable PPE. And Zac, you could probably attest to this, but we relied heavily on reprocessing. And it really took all hands on deck, because without that, we wouldn't have had the gear to go into rooms to provide safe care. In my home life, my partner and I also, he works in healthcare as well. So we definitely minimize our exposure to the public. We barely went out. It was basically just to gas stations and to grocery stores. Early on, we started wearing masks to the grocery store to be safe. So those are some of the ways that we kind of adjusted to the change.
And thank you for you and all your coworkers. I know, a lot of us have seen the images from the very beginning about the hours that you would have to wear all of the PPE and still continue to do your job. And that was certainly a new challenge, and you all rose to the occasion. So thank you for your incredible work. And you also just mentioned about grocery stores. So we're excited to have Caitlin here from the co-op. So grocery store, employees were deemed essential workers due to the risk of exposure to the virus. So Caitlin, how did you and your employees feel going into work the first few weeks of the pandemic, knowing that you could potentially catch COVID, and also that you potentially might need to confront customers who were not complying with your store's mask wearing policy?
Yeah, the first few weeks were tough, to say the least. We don't normally have to wear masks. So for us, it kind of started as the leadership team from the co-op encouraged us to wear a mask for our safety and for the customer safety. And then you would go home one night and come back the next day, and they would say, okay, now you're required to wear masks. And then we were asking customers to wear masks. And then we finally required customers to wear masks. It was really tough having to talk some of the customers through that. I think all of the employees were very aware of being safe for everybody, but some of the customers they weren't quite there yet. I know we had a couple of situations where we actually did have to call the police department in Hanover, and they handled a couple of really tough customers for us, which was really great.
Well, thank you for helping, with the education of the importance of we're all in this together and trying to make sure that your customers know the safety of it. So Zac, per guidance of CDC and with Dartmouth-Hitchcock Health, it's still important to wear those masks that we just talked about during certain settings, regardless of one's vaccination status. But we've all seen the horrible, excess garbage on the ground with masks and latex gloves just thrown everywhere. It's a sad sight. So why is it important for people to properly dispose of their masks and gloves? And how often have you and your staff picked up those discarded items?
That's a really great question, Audra. We see it a lot throughout the facility and on the grounds here at Dartmouth-Hitchcock Medical Center. It is a challenge to make sure that those are properly disposed of, but it's so important both for the safety and protection of our staff at Dartmouth-Hitchcock, but also the environmental impacts on both the environment itself, but also wildlife in our area that are potentially picking that up and then could be eating it, could be being harmed by it. So it's really important that we dispose of it appropriately. Not to mention, like I said, the risk to our staff and making sure that staff are protected when they're handling those types of wastes around the facility. But I would always encourage everybody to properly dispose of anything you use, especially PPE related to protecting yourself against COVID-19.
Yeah, absolutely. I feel like, years ago, there was those big campaigns for making sure people were disposing of their cigarette butts properly. And I feel like we need this whole campaign now for people to understand the environmental impacts on all of these disposable masks that are everywhere. So it's important. So I hope our viewers are taking note and making sure that they're disposing of their mask and gloves properly. So Amanda, what trends are you seeing in the COVID ICU now compared to a year ago?
So personally, one of the things that I've noticed recently is that our median age in the ICU seems to be going down. A personal thought that maybe I have to that is that as the vaccine has been being able to reach the older population, now we're seeing people that are exposed from a younger age group.
Mm-hmm. And that's why it's so crucial that we continue to talk about, the importance of when you're eligible for vaccination, please go out and get there. Although Amanda's lovely, you do not want to meet her in the COVID ICU at DHMC. So Caitlin,
absolutely.
We all remember, being at the beginning of the pandemic when toilet paper, most importantly, and cleaning supplies were among other items out of stock. I think that probably half the world has a 2020 Christmas ornament that might have toilet paper on it just to mark the occasion, because it was such an explosive thing that happened that we didn't have. So how did the pandemic affect the supply chain for your store, and how did you deal with that?
It affected it greatly. Our store is a little bit smaller than the larger co-op stores, so we don't get a lot of deliveries every day like the larger stores do. So we had to really look at what we were ordering, where we were ordering it from, make sure they had things in stock that we needed. Our merchandisers helped really greatly with that process. They were in contact constantly with our vendors, trying to figure out if they had toilet paper, if they had cleaning supplies, if they had hand sanitizer. There were pasta shortages, there were meat shortages, all dependent on where things were coming from. The companies themselves having COVID cases and having to shut down their facilities to clean for a certain amount of time to make sure everything was safe for everybody. And then just people being out of work because their doctors were asking them to be out of work because they were higher risk people. So it was a tough time to see the fluctuations in the food and the supplies for everybody.
Yeah, I think it certainly makes us appreciate, those who work in supply chains in the food industry, because, we all experienced going to the grocery store during the beginning of it and seeing, many food items that we, typically would easily grab, and they just weren't there and we didn't have access to it. And what a wake up call that was, to know that it could have such a severe impact in supply chain. And I think I have like 10 bags of dried beans left because that was all that was left on the shelf, and I still haven't figured out a good recipe for them, but I bet the co-op has some good healthy recipes. So
absolutely,
I might have to check that out. So Zac, how has your team adapted to its COVID cleaning protocols, from the height of the pandemic to now, and how have you amended protocols as vaccination rates and COVID cases have declined?
Sure. Yeah, I was just going to say, we had the same challenges early on that Caitlin had at the co-op with making sure we had the supplies we needed to be able to clean and disinfect the hospital and to have the toilet paper we needed to keep the hospital running. So I feel you on the supply chain concerns. From a cleaning perspective, it was an opportunity for us to question whether our cleaning practices were the right cleaning practices. And really look at the procedures and what we were using for cleaning chemicals to make sure that we were keeping the facility clean and safe. And initially, we were very we were very concerned about that, but found that a lot of our cleaning practices were cleaning practices that were sufficient enough to help keep the facility clean and disinfect against COVID-19. As the pandemic has progressed, we've found that there are better products and different products that we want to use that are not just going to help with COVID-19, but with a lot of other pathogens that we see in our environment. And so we've taken the opportunity to really evaluate everything we do and are improving continuously on how we handle cleaning of and disinfecting of the facility. And now that vaccines are starting to roll out and we're seeing more of our population come into the building vaccinated, that hasn't really changed how we look at the pathogens in the environment. We want to continue to provide the cleanest and safest environment for our visitors, our patients, and our staff that we work alongside, both in the ICUs and throughout the facility.
And you have quite the crew in environmental services who are just working diligently to keep DHMC a safe and clean place. And I know you can't walk the halls without seeing them there cleaning something. So a big shout out to your environmental services team for sure.
Absolutely, they're probably the best team that we could have to get through a pandemic with. And I echo your shout out. I don't think we would have been successful without the team that we have.
Very lucky. So I think as we wrap up, I think it would be very interesting to hear from the three of you as frontline workers who have been there from the beginning and dealing with some pretty tough things since the start. So I want to know how the three of you decompress. How are you disconnecting from work and your responsibilities and what you need to do, and offer some insights on how you decompress so that maybe our audience will get some tips and tricks on what might work for them. So Amanda, let's start with you.
I have two big things. So first, I find that laughter is often sometimes the best medicine, and laughter has carried me through some of the darkest corners of this year by far. The other one is get outside. Whether you're hiking, biking, having a bonfire with friends safely, it makes a world of a difference.
That's a great tip. And just to remind us that we need to, take that time for ourselves to get outside. So I'm glad you've been able to do that. Caitlin, what about you?
Similar to Amanda, just laughter. I feel like we've had a lot of laughter this year, even though it's been very, very dark and there's been a lot of struggle. But personally, I like to go home and either meditate or read a book. Those are my two things to kind of just get away from work and all of the stress that I have there.
Yeah, those are two great ways for stress relief for sure. So Zac, what about you?
I would definitely say getting outside has been very helpful, no matter the season. Any way you can get outside safely with families and with friends, and be able to be safe and get out and enjoy the outdoors has really helped me. And I think the other thing is just although my parents don't live near here, being able to pick up the phone and give a call to my mom just to touch base with her every once in a while to make sure she knows that I'm okay and be able to chat with her about how life's going has been really important for me.
I love that. Keeping the connection strong is definitely a great way for everyone's mental health for sure. So Amanda, Caitlin, and Zac, thank you for all of your hard work that you've been doing, and thank you for joining me today.
Thank you.
Thanks.
Thank you.
So next week will be our final Heads Up Roundtable conversation, and we'll talk about what's next for seniors. Stay healthy and stay safe. Take care.